A first of its kind beauty treatment is helping to smooth out patients' legs. Oh, Heather Lake, she's back and she's live in Solana Beach with how this all works. I have to tell you, Heather, when I was reading the T's, you know, helping the legs, I mean, Rose all, who? What? How does that work?
Helping the back of my leg.
I know. So here's the deal. Happy Monday, by the way. I have been saying the beach is going to get whatever body I give it this year because it's open, right? And so you can go and enjoy it. But if you want to improve that bikini body, get ready for pool season, Dr. Melanie Palm at the Art of Skin has got something brand new. It's the first of its kind. And I think a lot of people, we talk about this, women, when it comes to our legs, and maybe even some men, you know, depending on what swimsuit you're wearing this year. But it's like, you know, it's not so smooth sometimes, and you just want to get things looking really good for that beach body, especially in San Diego where everyone's like in such good shape. And maybe this year you just had a rough year and a rough go of it. So now there's something that's not just a lotion that says it's going to do it and it really does nothing, right? So what are we talking about here?
We are talking about QWO, which this is the product right here, and it's the first FDA-approved injectable for cellulite for the buttocks, for moderate cellulite in the buttocks. And this truly is a game changer. We actually have some sort of minimally invasive and surgical options to treat cellulite, and topical creams, like you were saying, don't really work that well. But this is the first injectable that you spend about the amount of time that you do in a Botox session here in the office, and we can treat cellulite over a series of 3 sessions.
So does it hurt, or what are you doing?
So I was actually one of the clinical investigators in the FDA trial. So what's really neat is we've had about 3 years of experience with it, although it just debuted about a month or 2 ago. And so it doesn't hurt. When we asked patients during the clinical trial, what's your discomfort level? It was sort of in line with getting a Botox injection. So a little bit of pain. Most of our patients said 1 to 2 out of 10 on a scale where 10 is just the most horrible thing you've ever experienced. So it is quite comfortable. I think the most significant thing is you do get some bruising with it. So I do tell patients it's worse with the first session. With the second and third, it tends to get better. We know that from the clinical trial data, but it can look like eggplant purple bruising. So it's definitely not something you want to do the weekend before you're going on your little...
In your first vacation out or whatever. There's a picture, so I want people to kind of see like the before and after. This is an illustration because it is very new and you're just starting it here in the office. And so we kind of see a before, and then it says like day, I think it's like 90 days or something. So this is something, if you're going to do it, almost might have wanted to start it during winter, or if you do it now, it's because you know you don't have any vacations planned.
Yeah, the bruising typically lasts about 2 weeks, so it doesn't last forever, but it takes 3 sessions. They're spaced about 3 weeks apart, so the photos are shown about 71 days after the treatment.
Okay.
So yeah, you do want to plan accordingly. This wouldn't be something you'd want to do and then take a weekend trip to Cabo that weekend, but it makes a remarkable difference. We actually posted some Instagram photos with just one treatment, and you see about a 60% improvement, so it's really remarkable. And we even talked about, I mean, we are in yoga country.
Yes, we
Everybody wears yoga. These are 2 of my own pairs of white yoga pants.
Okay.
And I think we love the idea of this, but what's hauntingly scary is oftentimes we see the textural changes happening on the back side of us. And it's not fair. You know, it doesn't matter what size we are. If you're thin, if you're carrying a little bit more weight, cellulite affects almost 90 to 95% of us. So the ability to sort of smooth this out and improve even your yoga pants this summer is great. And that's something you can wear while you're recovering from the bruise.
Okay. Before we go back to the studio, what do we need to save in our piggy bank if we wanted to do something like this?
You know, it depends on how much we're treating, but I would say an average, the national average for treatment for the full sessions is probably somewhere between $2,500 and $4,000.
Whoa, okay. But I guess if you want those results, and you want them, by the way, speaking of results, we put a picture up on our website. So go to fox5sandiego.com, click on the Seen On tab if you really want to see. And I was like blown away. I was like, whoa, this actually worked, because I do know a lot of the lotions, if you try them, you're kind of like, didn't really do anything, and I paid $50 for that. So if you want the results, Dr. Palm is here, Art of Skin, MD. I'm going to send it back to you guys in the studio for now. Did you get all of that, Christina?
I have a question.
It's like for the booty, for the legs.
2 questions, actually. So she said it's $2,500 for all 3, because she said you need 3 treatments. Now it's per treatment $2,500 or $2,500 100 for the 3.
Is it per treatment is 2,500?
No, that's the whole treatment
whole thing.
series.
Okay.
And in our next segment, we'll talk a little bit about what causes cellulite. We even have a little fat demo too.
Oh gosh.
Okay.
Okay, so maybe don't eat your Cheerios. Maybe save breakfast for 8 o'clock. At 7:30, we're going to show you
Oh.
real fat, like what it looks like and why it does that. No, you don't want that?
And
Yes,
Heather,
no.
one more thing. We're going to talk about this. And one last question. How long does it last? So you get all this injected 3 times. How long do you have the smoother,
Okay.
look for?
Is the smoother leg going to last for a long time, or do you got to come back in?
So that's great. It's getting after the architectural cause of cellulite. So right now the data follows patients out through 1 year, but more than likely this is a long-term change. We can't say it's permanent yet, but it probably is.
Okay. Well, there you have it.
Oh, okay. All right. This is very fascinating, Heather. Everyone's very intrigued. We're watching and listening very carefully. Okay, so we'll talk to you in our next hour. We'll have more of those questions answered. Thank you, Heather.